How's it going, guys? We have a medium difficulty question, cardio, steps 1 and 2. 60-year-old man, 3-month history of progressively worsening shortness of breath and exertion. That's left heart failure. Physical exam shows peripheral edema, jugular vein extension, and hepatomegaly. It's right heart failure, so congestive heart failure, although we don't know the cause yet. We'll keep reading. S4 is auscultated. This means diastolic dysfunction. S4 is when you have afterload causing a stiff ventricle, almost always left ventricle. If it's a right side S4, you'd have pulmonary hypertension causing afterload in the right ventricle. Transthoracic echo shows concentric left ventricular hypertrophy. Concentric, sarcomeres laid in parallel. This is afterload. Okay, if you had eccentric, sarcomeres laid in series, that's preload. So for instance, aortic stenosis, afterload in left ventricle, concentric hypertrophy. Aortic regurg, increased preload, eccentric hypertrophy. So ejection fraction 60%, that's normal, 55 to 70. So this is diastolic dysfunction. S4 heart sound, stiff ventricle with preserved ejection fraction. Diastolic dysfunction. If you have systolic dysfunction, you have a decreased ejection fraction. We have a biopsy of the myocardium. What's most likely responsible for the patient's condition? You say, I don't know what I'm looking at in the image. It's fine. I'll talk about it as we move through. Choice A, antibodies against valvular tissue. Wrong fucking answer. This is rheumatic heart disease. Okay, clearly it's not a kid who's had strep pyogenes, pharyngitis, where you make antibodies against the M protein of strep pyogenes, aka group A strep, cross reacts with mitral valvular tissue, almost always 99% of the time mitral valve, okay? And then it results in MR acutely, mitral stenosis later in life. Wrong fucking answer. Choice B, deposition kappa light chains, correct answer. Multiple myeloma, I've harped on, I've inculcated this in my clips that highest yield cause of cardiac amyloidosis on USMLE is multiple myeloma. Okay, so multiple myeloma, it's a cancer of plasma cells. What do plasma cells do? They secrete immunoglobulins. So immunoglobulin light chains, kappa lambda. Immunoglobulins are proteins. Proteins depositing where they shouldn't be depositing is called amyloidosis. This image is showing you cardiac amyloidosis. Just jack this image off of Wikipedia, very buzzy. The lighter areas, sometimes they can even appear white, are the amyloid, okay, the deposition of the immunoglobulin light chains forming proteins, the amyloid, whereas the darker areas are your normal cardiac tissue. Eosinophilic means pink, so you have lighter eosinophilic areas mixed with darker eosinophilic areas. It's a buzzy image. If you go on my cardiac PDF, you look at my other YouTube clips where I've talked about this, very similar image. And even though there's no symptomatology for multiple myeloma here specifically, nothing about hypercalcemia, nothing about lytic lesions, Bence-Jones proteinuria, etc. We eliminate to get there. Okay, so let's just do it. Choice C, endocardial fibroelastosis, wrong fucking answer. It's a pediatric condition under the age of 2, idiopathic fibrosis of the endocardium. I have said numerous times, when you don't know an answer, don't choose weird sounding shit. Okay, so some of you probably chose this. If this were a Qbank question, it would be like 12% chose C and they have no idea what it is. Wrong fucking answer. Choice D, giant cell myocarditis, wrong fucking answer. Similar to choice C, never even heard of it before, so it's wrong, okay? But theoretically, this is an antibody-mediated process against myocardium, and holy shit, you get giant cells that are multinucleated. Never seen it assessed on any NBME content. Nonsense, answer choice, wrong fucking answer. Choice C, systolic dysfunction, wrong fucking answer. As I already harped on, you're not going to have an S4 in systolic dysfunction. Okay, so you'd have a decreased ejection fraction as well. That's how we instantaneously know it's wrong. Systolic dysfunction, S3. 29 out of 30 times, you're going to see an S3 with systolic dysfunction. 1 time out of 30 diastolic, but it's an erratum on IM form 7 for the CMS forms as far as I'm concerned. I believe they fucked up. I think it's an erratum, okay? But S3 is systolic dysfunction, but you would have to have an ejection fraction that's low. We said 55 to 70, that's normal. That is the hallmark of systolic dysfunction, dilated cardiomyopathy. Choice C, wrong fucking answer. You know the deal. I'm to make more content like my stuff scrunching. Appreciate your time. That's it.